This session is about traveling and traveling with MS. I am Laura Santos. I am your MC for tonight. Most of you probably were here last night. I know that I don't let my MS stop me from traveling. I just take all sorts of little pee breaks, or I just take rests, or I have to really make sure I eat well, but I truly do not let traveling with my MS really get in my way. So we have a couple of folks here that are going to give us some information about traveling with MS. One other housekeeping issue, we have a healthcare day. Where is she? She was there, right here at the back. Wave. Classic Care Life. I think they changed their name. That's why I'm getting confused what the name of the company is. But they sponsored their employees to come here, so that's terrific. Ian Churchill and Pritma. I left out the R in your name when I printed it. Pritma Dhillon. Their biographies are in the program that you've got, and they're fabulous biographies. You need to read them to find out more about these folks. It's really quite nice, and I just pulled out a couple of little things. Some of you may live way down south and you go to the Glamorgan Safeway pharmacy, and that's where you might see Ian the odd time. Pritma, I don't know if you'll ever see her at WestJet, but I know she's got tons of information, and we'll be able to share a lot of her information that she's got. She works with the staff and on client services through WestJet. So please welcome Ian and Pritma on Traveling with MS. And they will try and fit the questions within they're going to tag team with their slides, and they'll try and put questions either in the middle or at the end. These folks have never met before. They've been typing and phoning, but they've actually never met before.
Yeah, well, welcome. I'm glad that everyone can make it here today. Thank you, Laura, for that introduction. So we'll just get right into this. Ian can introduce himself when he comes up here in the next couple of slides.
Not the next one.
So basically what I do for WestJet is I take care of the WestJetters, as we call them, our employees, our people. There's about 8,500 WestJet employees presently, and my team takes care of all the folks that are going through some health concerns in their life, whether it be disability or whether it just be a general health concern and they want to stay on the job but get some extra support through our team. We're a confidential resource for them. We also deal with, we also work with some guest-related issues, and I'll get into those a little bit later in the presentation. So the purpose of today's discussion is to really equip you with some tools and some resources so that you can ensure that your travel experience is a good one, and you can prepare for it with little steps along the way, all the way from when you first start planning your travels to when you get onto the aircraft and at your final destination. So some of the objectives for today, again, preparing for healthy travel, making sure that you plan ahead. We all have to plan ahead and be proactive when we travel, whether you're well or whether you're struggling with a medical condition. We're going to talk about some travel health consultations, as well as some considerations for general wellness and overall safekeeping at your final destination. Vaccinations, as well as medical equipment, what can go on the aircraft, what can't, how to stow and carry your medicines, as well as any other equipment you might be traveling with. We're going to talk about supports during travel, mobility assistance, some things particular to the aircraft, some aircraft or airline-specific programs as well, and then overall health and safety at your final destination. So I think that, yeah.
So until about a year ago, I was just a regular pharmacist at Safeway, and then I took a trip to Boston, and while there, I took a test to become a certified travel health practitioner, I guess you could say. So now, in addition to being a regular pharmacist, I also consult with people at the pharmacy, and like a travel clinic, I arrange vaccinations and make sure that they're safe at their destination. So safety is really the name of the game. You want to maximize your odds of being safe when you get to wherever it is you're going. So, like Pritma said, the first step in that is planning. You got to make sure you plan everything out, you know exactly where you're going. when I say know your destination, I don't mean just know its name, I mean really know it. For me personally, planning is almost as enjoyable as vacation. Not everybody's the same as me, but I really love sitting there and Google mapping it right down to the street level and walking down the street before I'm actually there. So do that kind of stuff. Know your destination, know it inside out if possible. Good website to start your searches is this one. The Canadian government puts it out, travel.gc.ca, and it's got a ton of really useful information. You just drop down the menu with all the countries of the world, wherever you're going, pick your country, all of a sudden a ton of information pops up and start reading. It tells you everything from possible crime issues at the destination, gives you tips on the culture at the destination, which could come in handy if you're planning on wearing a bikini in Saudi Arabia. It gives you details on political unrest that might become an issue. It's really good to know, because you might be thinking everything's fine and all of a sudden your country might become an issue. So check out that website. In addition, on that website they've got tons of links to various things like the traveler's checklist. It's helpful to have a big list of everything you should do before you leave. They got that checklist there. I have the checklist at the Safeway exhibit. If anybody's interested, they can pick one up from me and Donna at the Safeway table. And there's a registry of Canadians abroad, which could come in handy if you're, stuck in a country that has some sort of natural disaster, like a tsunami or something horrible like that. The government probably would want to know who's there, and your name will be on the list. So I would say register for that too. Another important thing is, it says on my slide, know your limits. I think most of us kind of know our limits. I guess it should be remember your limits. If you're like me, you really start planning way too much stuff for vacation, and it's a common failing of all of us. We're going on vacation, we're spending a ton of money, we want to get the most out of it. It's very easy to over-plan and overbook. So my rule of thumb is always schedule twice as much time for everything you're planning on doing. If you're told it's going to take 2 hours, plan 4 hours. And that way you're going to probably be able to fit it all in. It's good advice, but it's hard to follow. I'm also a bit of a pessimist. I like to anticipate worst case scenarios, and I suggest everybody does. What's the worst thing that could happen on your trip? It may not be a very fun exercise, but if you deal with that in your mind beforehand, you're way more likely to be able to handle it if it happens. And that's my theory on pessimism being a virtue. You're ready for everything, and if it doesn't happen, and it probably won't, you're that much happier because it didn't happen. But if you're prone to various things like incontinence, plan. What are you going to do if you have an incontinence attack on the airplane? What are you going to do if you lose all your meds? What are you going to do if you need to get medical assistance? If you have an MS flare-up while you're on vacation, what are you going to do? All those kind of things. Good exercise to go through. So ultimately though, travel consults are what you should be booking ahead of time, at least 2 months. Nobody knows the destination and the risks that destination could pose to you better than a travel health expert. And like I said, it's all about risk reduction, and the travel health clinic or the travel health expert will tell you what to do to minimize your risks while you're at your destination. Having said that, your neurologist, your MD, hopefully know your particular MS better than anybody else, so it's really important you also consult with them regarding any travel plans ahead of time as well, and that they're okay with it too, and they might have some better advice even than the travel clinic, so keep them involved. But the travel clinic is still vital. You have to, and not just MS patients, anybody really should be booking appointments with somebody. So ultimately you'll get vaccine recommendations at the appointment, depending where you're going, of course, and what you're doing and how adventurous you are. That's why I say 2 months, because some of those vaccines require a series of doses, and some of them require some time to actually become effective, so you want to be properly protected for your arrival. However, having said that, 1 day before you leave is still better than nothing, so just book the appointment. And I'll go drink some water and let Pritma take over.
I hope we're doing okay for not having rehearsed this before. So this next slide here, I stole this slide actually right off of our pilot and in-flight training presentation. So we go through a lot of health and wellness advice for our new flight attendants and pilots because they're traveling quite a bit. and at various destinations. So it's always good for them to understand how travel impacts their body system. So again, along the lines of preparation, keep in mind how travel might impact your body. It's something that is different than your day-to-day activities at home. So it does disrupt your normal sleep cycle. It will impact your circadian rhythm because your cycle of waking and sleeping will be altered depending on where you're traveling to, whether you're traveling east to west or if you're traveling, across the Atlantic, wherever that might be. Your metabolism is going to be impacted as well as your digestion, so keep that in mind. And your circulation is also going to be potentially impacted when you're traveling at altitude, especially if you're going to have some layovers and it's not a direct flight. You're going to be going up and down a couple of times, and so that's something to keep in mind as well. So it's always good to prepare well in advance and keep those considerations in mind when you're preparing for your travels with respect to medications or even foods that you can take with you. There are some special considerations you have to make with foods transporter. Of course, no fresh fruits or vegetables, but it is always good to take a healthy snack in your travels, especially if it's within Canada, considering that airport food isn't the most healthiest of food at times. So along that line, get adequate sleep the night before you travel. It will be a long day most often, especially if your flight is longer than 4 hours. Eat nutritious, non-greasy meals before your travels. Practice good hand hygiene. That's the best way of staying safe and healthy in your travels, is if you practice good healthy hand hygiene and you avoid touching your nose and your eyes and all of that while you're traveling, because when you're traveling in a big tube up in the air, that's sometimes the worst place for bacteria, although we do keep our aircraft quite clean and our aircraft is equipped with HEPA filters. You always want to practice good hand hygiene. Something to consider is also compression stockings. So if you haven't talked to your physician about that, that might be something that you want to consider before your travels, especially if you are going to be embarking on a long flight or with several layovers and multiple connecting legs.
So vaccinations, we'll talk about that because that really is a big part of the travel consult. Pharmacists started vaccinating people 4 years ago, and I'm quite enthusiastic about vaccinating. Not sure why, but I really enjoy that part of my job, poking needles into people's arms. They don't always like it, but I seem to enjoy it. One thing I want to point out is patients with MS are not really considered, in general, any different from the regular population. So it is, unless there are some exceptions, which I'll mention in a moment, but in general, all MS patients should be free to get vaccinated with almost all of the vaccines out there without worry. Unless you are currently having a flare-up of your MS, then you shouldn't, especially not if it's a live vaccine. And you should wait 4 to 6 weeks after a flare-up before you get vaccinated, if possible. Also, if you're currently immune suppressed, like a big dose of steroids, obviously it's not a good time to get vaccinated either. But outside of those two cases, no worries. There are some exceptions, but we'll talk about that in a minute. First, just all the routine vaccinations, those are the ones that kids get mostly, but adults also have to stay up to date on routine vaccinations. And I frequently encounter people that have no idea if they're up to date or not. It's a very commonly missed thing. So if you don't have your little list of all your vaccines somewhere in your medical files, make one. Problem is, if you think you're vaccinated but you can't prove it, you're as good as not vaccinated and you'll get revaccinated. So records are really important when it comes to vaccines. Got a few examples of routine vaccines there. Ones that get missed. Actually, before I mention that, the most important routine vaccination is the flu vaccination. That's coming up in 2 weeks, October 15th. We're going to get all our flu vaccine. At the Safeway pharmacy, we're going to be working like crazy, trying to squeeze all the vaccinations in between our regular work. But I strongly recommend everybody gets vaccinated because that's one of the #1 things you can do to reduce your odds of illness while traveling is a flu vaccine. So consider that. Also, tetanus gets missed a lot. 10-year booster. A lot of people don't know when they got their last tetanus. And another one that gets missed even more frequently is the whooping cough or pertussis. That one is a single booster for an adult. And a lot of people don't know that, and a lot of physicians don't ask about it. So if you can't show that you've been vaccinated against pertussis, you should throw that one in there as well, the routine vaccinations. Then, of course, there's the recommended vaccinations. That's the fun part of the travel consult, and really it's the travel health professional's job to figure out which ones you need. It's based on your itinerary. First of all, where you're going. Secondly, what you're doing exactly while you're there. And it can get, there's a lot of vaccines out there, it can get a little complicated, but make sure you get that travel clinic appointment. And then, in addition to the routine and the recommended, there's the required. And this one's a little more interesting because there's international health regulations that force people to be vaccinated when they go to certain countries. Mainly that is yellow fever. We'll talk about that in a little bit, but I've occasionally seen polio and also meningococcal occasionally required, specifically in Saudi Arabia for the Hajj pilgrimage, which is coming up pretty soon. The yellow fever is the one that everybody talks about. It's can only be given at a travel clinic, at a travel vaccination place, and they give you a form. It looks like this. There is a process for some people who can be given a medical waiver. I'm not sure if it's always advisable to get a waiver as an MS patient. I think if the risk of yellow fever is significant, it's better to receive the vaccine. The vaccine is questionable in MS. There was a study in the archives of neurology about a year ago, and it showed, it was only 7 people, mind you, not a whole lot of people, but it did show an increased risk of an MS flare-up within 6 weeks after the vaccine. So that was very interesting. Small study, more data required as always, but at this point it doesn't look like a very good vaccine to get as an MS patient. But like I said, if you're traveling to a yellow fever risk area, the disease is nasty. It's got about a 20% fatality rate, and if your risk is significant, you're better off vaccinating and taking the chance of a relapse than you would be not vaccinating. So it still may end up getting recommended. Let's pass it back to Pritma.
So we'll talk a little bit about clearing security with your medications and such. CATSA has a great website. They have detailed information about anything and everything that you're allowed on board the aircraft in your carry-on luggage. It is recommended that all medications travel with you on your person, so that means on your carry-on, in your carry-on luggage, just in case you might require it on board the aircraft or at your final destination, or in case we lose your luggage or any other event that might happen. It's always important to carry all of your medications on you within the aircraft in your carry-on luggage. So liquids and gel-based prescription medications are exempt from the carry-on liquid restrictions. Tube feedings and such, anything that is medically necessary is generally accepted on board the aircraft. Diabetes supplies, the syringes, the needles, as well as the vials. Inhalers, again, you can see a detailed list at CATSA. Just the only consideration to make is ensure that all of your medications are appropriately labeled from your pharmacy. So sometimes you do get bulk supplies and bulk medications, especially in liquid form, or if they're injectables, you get those in bulk sometimes from your pharmacy. So make sure that the individual vials are labeled professionally, not labeled by yourself, but by your pharmacist, so that it shows the physician name, the patient name, what the drug is, and the concentration and whatnot. So all of that can be carried on board within the aircraft. Other things to consider, a lot of times we have guests traveling with a variety of medical equipment. We've seen everything from LVADs to suction equipment to oxygen tanks. You know, you name it, we've probably seen it. Some devices do require special approvals. So it's best to contact CATSA or to contact your airline to ensure that it is permissible on board the aircraft, and if any special considerations do need to be made. Mobility equipment is generally transported in the belly of the aircraft, so mobility equipment can be used all the way up until the boarding lounge through security, and then it will be gate checked at that time and taken to the bottom of the aircraft. Again, with mobility equipment, powered wheelchairs There are some special considerations around powered wheelchairs and their batteries, because batteries, there are some restrictions around batteries because they are explosive. So of course there's some safety issues surrounding that. So it's always good to contact your manufacturer and also carry the manufacturer's information with you if you do have a powered wheelchair. Especially some of those wheelchairs are quite expensive, and so you want to make sure that we are aware of how to handle them appropriately. So oftentimes the manufacturers do provide you some information on that. And it's always good to travel with, like Ian mentioned, a list of your medications and a list of what you're currently on, just in case, not only for inside the aircraft, but also at your final destination. Always be prepared. You never know what's going to happen. You never know when you might need that list, or if something should happen, at least you have that information on you.
So yeah, continuing along that same thing there, traveling with meds. Number one thing for traveling with meds is always try to keep it in your carry-on. Don't put it in your checked luggage. A couple of reasons. First, personally, I don't trust the checked luggage. They throw them around. I'm sure WestJet doesn't, but they throw them around. They leave them out in -30. I probably wouldn't put it in the checked luggage. Carry-on luggage. Another rule of thumb I usually use is carry double what you actually need. May not always be feasible, but if you can, it's a good plan. And if you are carrying double, or even if you're carrying just enough for your trip, I would still try to split that up. Usually you've got a companion if you split it up, because you never know. Even your carry-on luggage can be stolen or forgotten. I'm sure WestJet inherits a lot of people's forgotten carry-on luggage. So, beware. Tying in with the worst case scenarios, you can leave, what's going to happen if you leave your stuff on the plane. Pritma mentioned the copies of prescriptions, I think. Really important, especially if you're the one that gets interrogated at the airport. Just ask your pharmacist. I print them off all the time. We got them on the computer. Just ask them for a copy of your prescription. Carry it with you, of all your most recent prescriptions, or at least the ones you're carrying with you. Also, you want to have that letter from your doctor, like Pritma mentioned. But something that sometimes is useful is if you're traveling to a foreign country with a different language, if you can get it translated into their language, that could be very helpful as well, if you know somebody that can do that. Otherwise, just make sure it's on the doctor's official letterhead and it all looks official and important, and it describes what exactly your medical conditions are and how exactly they're being treated. But there are actually, this traveler clinical record, there are actually products out there that do that for you. All you gotta do is take it to the doctor. The doctor will fill it out, take it to your neurologist as well. Have them all fill out the appropriate parts. The IAMAT.org website is a pretty handy website. I really like it personally. The membership is free. They will ask for a donation. You're under no obligation to donate, but I would suggest you become a member, and they will send you the travel clinical record, among other things. You would have access to a list of English-speaking doctors at various destinations. It's a good website just to check out. Stuck on this slide, it kind of just ended up there. It says something about travel health insurance. Neither Pritma nor I are really experts in that field. All we can really say is it's hard work getting health insurance. Make sure you do your research. You'll find varying prices between different providers. And you probably already know, be totally honest. You withhold a single piece of information that you might think is irrelevant, they can come back and haunt you and say, oh, we're not going to pay. So every single possible thing that ever happened to you, every change in drug, make sure you record everything when you're filling out those forms for travel insurance, because I've heard some horror stories of people that were denied for something that they thought was innocuous. So that takes a lot of work though, so that's why we're not going to really discuss it in detail today. So,
Do you recommend a good company?
Well, no. I recommend you do the research and talk to them when they tell you something. Don't take them on their verbal. Make sure you see it in writing, get it in writing, even if it's an email. So if they say, yes, we'll cart you off the top of Kilimanjaro in a helicopter, make sure you see that in there and exactly how it works. And it's, like I say, it's a lot of work, and it's a lot of reading really badly written, well, I guess it's not badly if you're an insurance broker, but uninteresting documents. So you just have to do your homework and research on that one. Also, Pritma did mention it as well, but make sure you don't take, like if you're using blister packs, sometimes that might be an issue. If you're putting your meds into a dosette, you've suddenly taken your meds out, you've got some unidentified drugs that nobody knows what they are at the airport, and you get that overzealous guy that thinks you're a drug abuser, and it can be nasty. So keep all your meds, if possible, in the original containers. If possible, keep the patient information that came with it. That way you can, show that you're legit if it comes to that. Hopefully it won't, but it's better to be prepared just in case. This is a big one, I guess. Medications quite often need to be kept cool, which is sometimes a tough task when you're traveling. Most of the disease-modifying drugs, though, like the Copaxone, the Avenix, the Rebif, as you probably know already, they can be kept out of the fridge for up to 30 days, which is really nice. Most vacations are going to be covered by that. However, the manufacturer is pretty strict because they can only go on their legal documents. If you take it above 25 degrees, they won't guarantee its potency anymore. And the minute your meds hit 9 degrees, the countdown starts. I would recommend still trying to keep your stuff refrigerated anyway. Just try to keep it in that 2 to 8 zone. If it does drop out of into the 9+ zone, then fine, then start the countdown. You should be covered for your trip. But obviously the potency is going to be more guaranteed the cooler you keep it. And usually you can make arrangements. Cooler packs are available. Medcooler.com is a good website to go to if you want to check out various cooler packs that are available out there. The customer service programs attached to your med usually are pretty good that way. I know they provide usually really small med packs. I think the Copaxone one I ordered for somebody once was only capable of holding 5 days of doses, so it wasn't the greatest. But take advantage of it anyway, it's free. Keep in mind if you're doing your planning and you're getting a fridge in your hotel, those hotel fridges are notoriously temperamental, either too hot, too cold. And as you probably know, too cold is actually the worst case scenario, because if your meds freeze, they're ruined. So what I would suggest is get like a Diet Coke bottle, put about a tablespoon of water in the bottom, stick it in the fridge, see if it freezes. If it freezes, that's not a good sign, and you'd have to adjust. Also keep in mind the top of those fridges is usually way colder than the bottom because of that little freezer compartment there. So keep that in mind as well. And a good piece of advice as well is the Ziploc bags. Have a big wad of them on your person. They always come in handy. You might get stuff confiscated if you have like a big gel pack keeping your stuff cool and the customs guys don't like it. You're left with no cool packs. If you've got a big wad of Ziploc bags, once you pass customs, you can go to the restaurant or find somewhere that has ice, crush it up, put it in the bag, and you're good to go again. And you can pretty well find ice anywhere, so as long as you've got the bags to put it in, you can keep your meds cool that way. I think that's all. Oh, you know what? I was thinking while I was sitting down there on the yellow fever, I had forgotten something about the rules. There are countries in the world, in mostly Africa and some of South America, that have yellow fever. But there's also rules where a country that's at risk of yellow fever may enforce a vaccination on you as well. It's rare, but I have heard of cases where somebody transited through a country with yellow fever. They didn't get off the plane. They continued on to their destination, somewhere like the Philippines, which is at risk but not currently suffering yellow fever. And the Philippines, you require that vaccination just because you were in wherever it was, Uganda or somewhere like that. So keep that in mind. It's an important point. I would say you don't need a vaccine in that case, but they may enforce it on you. So it's really important to know the rules with yellow fever when you're traveling. Okay, let's swap with Pritma.
Speaking of temperature as well, Ian brought up a good point. The temperature in the belly of the aircraft is not regulated, so that's another reason not to pack your medications in your checked luggage, because it does get very hot or very cold down there. And there are periods of time where we do go through an embargo where we don't even allow pets down there because of the temperature now that we've talked about preparing for your air travel, we're going to talk a little bit about supports available to you in transit during your travel experience at the time you get to the airport and onto the aircraft. So mobility impaired guests, if you are traveling and you do require some mobility assistance, it is actually required by air carriers through Transport Canada that we ensure that air travel is safe and possible for disabled guests. WestJet transports over 40,000 people a day, and as you can imagine, a significant percentage of those individuals are disabled in one way or another, and many of them are physically restricted or limited in their mobility. And therefore, all of our customer service agents as well as guest service ambassadors are trained in transfers, in 1, 2, 3-person transfers, and it's their responsibility to ensure that guests are supported during their travels, so they can assist guests from the time of check-in through security into the boarding lounge and onto the aircraft, and they have specialized training for that. There's also something called a gate pass. If you are traveling on your own and you do require some assistance, but you're hesitant to use the assistance provided by the airline, you can often have family members get a gate pass at the time of check-in so that they're able to go through security with you and wait with you in the boarding lounge until you're able to get onto the aircraft. And then they can exit after that. So that's something to keep in mind. At WestJet, we've really wanted to be proactive in the way that we work with our passengers that do have mobility impairments, and therefore early to late last year we started a pilot study on 2 devices. One is the Dhillon wheelchair mover and another is the Eagle 2 passenger lift. The Eagle 2 is it's kind of like a Hoyer lift but specialized for the aircraft. So for guests that are quite severely mobility impaired, it's a mobility device whereby we can lift passengers and get them into the aircraft without having to use our employees or 2, 3-person transfers, because as you can imagine inside the aircraft, it's very confined, it's very difficult, it's difficult on the guest as well. So the Eagle allows for a dignified way of transport and transfer into the aircraft of folks that are, for instance, quadriplegic, paraplegic, and in those difficult circumstances. So we launched that pilot last year, and we just received delivery of about 15 of them earlier this year, and we're dispersing them throughout our bases, and by the end of next year we hope to have an Eagle device at every Canadian base, which is about 32 bases in Canada, to ensure that our passengers are safe in the process of transfer. The Dhillon wheelchair mover is another device that we've recently purchased, and that's an electronic wheelchair mover. So it's at the push of a button, it's mechanical, so that's more for the purposes of preventing injury on our employees as well as on the guests, because it's sometimes difficult moving guests in wheelchairs that are not powered onto and off the aircraft, especially on inclines or ramps, things like that.
Excuse me. Just have a question about the Eagle 2 lift. Because I've traveled a few times in the last year and I've heard about it and I've asked about it, but most of the people I talk to say we haven't had training or it only works on this side. And I do find it quite tight to be in the Washington chair. If you want to try the Eagle 2, do you have to ask ahead of time? Or I've been hearing about it, but I've never seen it. And I've traveled quite a few times over the last year, so I'm just kind of wondering when we're actually going to get to try it.
Yeah, you've been hearing about it because there's a huge buzz about it, and our WestJetters are anxious and so ecstatic to be receiving this equipment. And you know, as you can imagine, in a large company as ours, it's you know, going through the process of the pilot study, you know, passing all the safety regulations and all of that took a lengthy period of time. So the buzz has been out there for over a year. So we did take delivery of them, and we're still just working on the training. So they've been delivered to the bases, but now what we're doing is we're having to go to each of those bases and do train the trainer program. So there's only, I think, one base right now that's actually using it. because they've been fully trained. So we're hoping by the end of this year or early next year, at least those 10 to 15 bases will be trained. But again, you're still going to experience bases that don't have it because it's only a few out of the 32. So, you know, we do have to budget for it accordingly. They are expensive devices, so it's a kind of a few-year plan to deploy them across the bases.
Who makes the decision about whether that's used versus the Washington chair? Do we have to ask about it ahead of time, or
so it's an internal criteria in terms of what would be used. Yeah, but if you are aware of it now, like you guys are, you can definitely ask, and I'm sure people would be more than happy and willing to use it. Yeah.
All right.
And speaking of the Washington chair, for those of you that don't know what it is, it's a specialized wheelchair for the aircraft. So for guests that do require full transfer assistance, they're transferred into the Washington chair outside the aircraft and then maneuvered onto the aircraft with it because it's narrow enough to fit in the aisle of the aircraft. And that stays on the aircraft for guests that do need to go to and from the bathroom while in flight, and the flight attendants can assist with that. Navigation assistance is also available, of course, for folks that are visually impaired, whereby our customer service agents can escort them into the boarding lounge onto the aircraft. Flight attendants are also trained on how to brief those individuals with a tactile safety briefing, a one-on-one safety briefing for those individuals. Bulkhead seating. We get a lot of requests for bulkhead seating, so I wanted to put this in there. Bulkhead seating cannot be pre-reserved, so it's on a first-come, first-served basis. It is blocked for folks with special needs and disabilities. However, because we do transport 40,000 folks a day, and it is difficult to start to adjudicate who deserves it versus who doesn't, and all of that, it becomes very difficult in terms of processes. So we've just blocked the bulkhead seating, and we reserve it on a first-come, first-served basis based on time of check-in. However, the aisle seats of the bulkhead are reserved for able-bodied guests because they are going to be required to assist in the event of an emergency with the two front doors should something happen. So those are reserved for able-bodied individuals. The one thing to keep in mind about bulkhead seating as well is for those folks that do require assistance with transfers, sometimes it becomes difficult because in the bulkhead, the armrests do not go up. So that's something to keep in mind, where yes, it might be more convenient to get you into a seat there, but if for some reason you know, if you can't allow the armrest to go up and you know that would be difficult for you, just keep that in mind. Because some guests, we do have to transfer and then use the magic slide to get over into the window seat, so it is difficult to do that, of course, when the armrests do not go up. And I think that's it on that slide. Supports available in flight. So I indicated this before, all of our staff are trained on how to conduct guest transfers as well as one-on-one safety briefings for folks that are visually impaired. Flight attendants can also assist with ambulation to and from the bathroom. The lavatory can also be locked from the outside by the flight attendant for folks that are unable to do that themselves. And then they have a procedure that they brief the individual on in terms of knocking, and they'll stand by and open that door when they're ready to do so. So what our flight attendants are not able to do is assist passengers with their personal care needs, such as hygiene, feeding, if you need assistance inside the bathroom, if you need assistance administering your medications. Our staff are not able to support you with that, so that's where you would require either you're independent and you're able to do that, or you would require a personal attendant with you who's able to support you with that. Medical aid on board. So we get a lot of questions around how are we equipped on board? What if something happens in the aircraft en route to our destination? So all of our flight attendants are trained in first aid, and they're actually quite extensively trained above and beyond basic first aid. We do also have a satellite phone on all of the aircraft, and that's connected directly to emergency physicians. So there's always that. When in an emergency situation, there is a protocol where flight attendants always have to contact the physician over the satellite phone to determine what the next step should be. There is an AED on every single aircraft as well. We're the only carrier in Canada that has one on every single aircraft. Also, there's a comprehensive EMK, emergency medical kit, which has all of the life-saving medications on it, IV, oral, medications such as epinephrine and all of that. And we also carry adult and child EpiPens. Again, we're the only airline in Canada that has that. And we have a comprehensive first aid kit as well, which hopefully you guys will never need any of this stuff, but just in case to ease some of your fears. The next slide here is about traveling with a medical companion. So we understand and appreciate that many individuals are dependent to some degree on a travel companion, whether that be a loved one or whether that be a medical professional. So guests with significant disabilities that do require support above and beyond what our staff can provide, which means, you know, if they require assistance with their feeding, their personal hygiene, their medications, we do have a program at WestJet, and it's called the One Person, One Fare program, where individuals can apply and their application will be adjudicated by one of our nurses, such as myself, to determine if they're eligible for the program. This program came about in 2009, and both Air Canada and WestJet have this program. It's basically two forms that you have to complete. It's one form, and the guest completes one portion of it, the physician completes the other portion, and then we adjudicate it. And the adjudication process is not based on diagnosis per se, it's based on the personal care needs of that individual, which vary from person to person. As you can appreciate with MS, everyone has a varying degree of symptoms, it's progressive. So if you're relatively independent, you may not be approved, whereas if you're significantly dependent, there might be an opportunity there for you to travel with a companion at a significantly reduced rate. So basically, if approved, the companion would travel free of charge. WestJet would cover the cost of that individual to travel, with the exception of taxes and airport fees and any fees that we collect on behalf of the government.
Only within Canada, though, right?
Yes, that's only within Canada. So that program currently is only legislated within Canada. There's no such program in the United States at this point in time. So it's only for domestic travel. Great, so I'll hand it over.
Okay, so health and safety at your destination. I think this is my biggest section. Pritma already mentioned about the hand washing idea. Very important. Just so you know, the proper technique, I'm sure most people know this, but I go over it regularly just to make sure. It's 20 seconds. You have to build up a good lather, get all the edges and all the angles of your hand. And if you want to count 20 seconds in a fun way, it's 2 versions of the Happy Birthday song. But don't be like my kids. I see my kids doing it really, happy birthday to me, happy birthday. So it has to be the regular style, yeah. I think, yeah, I heard that too. But yeah, I've always gone with the 2 Happy Birthday songs. So yeah, whenever you get that urge to itch your eye or pick your nose or stick your finger in your mouth, make sure, when did I last wash my hands? If you can't get to wash your hands, and this happens to me in the pharmacy all the time, you know, I've just dealt with somebody who was hacking and spluttering over their prescription and hands it to me. And I'm like, okay. And then I know my hands might be possibly contaminated, so I don't want to. And then inevitably my eye will start itching, and I really want to itch it. Backup is the hand sanitizer. Just make sure, though, the hand sanitizer is 60% alcohol or higher, because there's a lot of other products on the market. The only ones proven to make a difference are the 60% alcohol or higher. So keep that in mind, and it's a good backup, so have one on you all the time whenever you're traveling, or you know, throughout regular life, I guess, because it's always a risk. So having clean hands, you know, it'll lower your risk of colds, flus, various infections. At this point, I'm going to kind of seek that into the diarrhea talk, because that is a big issue of traveling. Now, when it comes to diarrhea, traveler's diarrhea, obviously clean hands in the kitchen or clean hands with the people preparing your food is far more important than your own hands, and that's where most of the problems come in. Clean hands are so hard to come by. Even in a 5-star restaurant, people skip it. So, you know, I think I remember some physician somewhere quoting about how most diarrhea is essentially somebody passing on their fecal matter to you, and that's essentially what it is. And that's how we get these infections and other bad things on a trip, like hepatitis A even. So 1 in 3 travelers are going to suffer traveler's diarrhea to some extent. That's a pretty big stat, but that's for all international travel. If you're going to a developing country, that's going to be a lot higher, 50, possibly higher % So it is very common, and probably most of you here at some point have experienced it. Most of the time it's self-limited and everything's fine. You get a little bothered by it, but sometimes it can be super nasty. So obviously doing what you can to reduce your odds of traveler's diarrhea is a vital part of traveling and a vital part of being safe while you're traveling. So one thing you can do, bottled water, bottled beverages, obviously they're safer. There's less likelihood of somebody contaminating it when it comes from a factory than it would if somebody's, you know, grabbing the ice, throwing it in your drink, or even just rubbing their dirty finger on the top of your glass. Those things happen, so bottled water is good. Bottled cola apparently has an even lower chance of being infected, probably due to the acidity. So if you like cola, Diet Coke, they're pretty safe. Probably beer too, who knows. But like I say, the consequences of diarrhea are bad enough, and obviously worsened if you're already dealing with MS, so you really want to minimize your odds of suffering that way. The traditional advice for preventing traveler's diarrhea has always been boil it, cook it, peel it, or leave it. It's good advice. The only place that this seems to be actually adhered properly is the army. Regular folks seem to have trouble. Most people just give up after a few days. But anyway, it's still good advice. If you can boil your water for a minute at sea level, and as you go higher for a little longer, so 1 to 3 minutes. I think if you're at 3,000 meters, which is pretty high, you got to boil that water 3 minutes. That'll kill off 99.5 or something % of the microorganisms that could be in that water. So that's a good way to sterilize stuff. You can buy these things here. I got 2 examples there. I think one is the Pristine water system, and then the Aquatabs. There's various products on the market. They're chlorine based. They're really popular with hikers, because hikers typically have to drink river water or lake water, which is a cesspool of infection sometimes. This stuff will, if you follow the instructions and wait the right amount of time, it will sterilize that water. It's good to have on hand, I think, when traveling in developing countries too. If you don't trust the water somewhere and you really have to drink, you might want to treat it ahead of time with that stuff. They're cheap and easy to pack, so consider those as well.
Ian, do you recommend people take a anti-diarrhea medication before you go to the developing
Yes, for sure.
It saved me a lot of times.
Yes, that's typically that will be prescribed during the travel consult. Any developing country, usually we will give out a 3-day course of antibiotics, Cipro or azithromycin. Depends where in the world you're going, because there's some places where there's resistance to certain antibiotics, so that definitely is good to have on hand. But I wouldn't recommend it for minor diarrhea. Like if you're just getting a little bit of the runs and you can deal with it, I wouldn't get into the antibiotics at that point. If it's really bad, it's affecting your ability to function on your holiday, then for sure get it going right away and try to knock out the bacteria. Hopefully it is a bacteria, because there's other causes of diarrhea when you're traveling. But yeah, have the antibiotics on hand. And I'll be discussing that on a slide. I got a slide where it says just in case meds. So we'll go over all the meds that you probably should keep with you when you're traveling. If your food's coming out to you steaming hot, like you can see the steam coming off it, that food's pretty safe. It's essentially being boiled in a way, so those foods are safe when you're traveling. Foods to avoid probably would be maybe the buffets, or sometimes a little questionable. You don't know how long it's been sitting there, and who's coughed on it or dropped their dirt on it. So street food, this roadside stands. Sometimes that food's really good, but the risks are higher, of course. You don't know the hygiene of the person preparing the food. You don't know how long the food's been sitting there. But again, if you can see that they're really busy and they're constantly serving hot steaming food, it probably is safe, but you're still taking your chances. Yeah.
What about over-the-counter medications like Pepto-Bismol or something like that?
Yep, Pepto-Bismol, you can actually prevent traveler's diarrhea with it, but it's a little labor intensive. 4 times a day, every day while you're traveling, it actually reduces traveler's diarrhea by 50%, which is significant.
If you get to the countries, where's the best way to find that sort of stuff?
Depending where you're going, I would advise all meds be purchased ahead of time if possible, because I trust Canadian drugs more than any other country. So if you can, purchase ahead. And Pepto, I don't usually make people take that. Imodium probably is good one to have on hand. The Imodium loperamide can be used in conjunction with the antibiotics, and it slows your gut down. However, I've had people complain of being constipated after they finish their Imodium, so there's always that as well. The shellfish and salads is another one I should mention. Better to avoid. I mean, if you like lobster and crab, it's kind of hard if you're going somewhere known for it, like Vietnam, and you got to give it up. But those are also higher risk foods. The biggest risk, of course, though, when you get diarrhea is the dehydration. So inevitably somebody's going to get diarrhea, and one of the health risks associated with that is the dehydration that occurs with it. So another thing to have with you is some Gastrolite, or those little sachets of powder that you can mix up your own oral rehydration solution. If you do find that you're losing a lot of fluids, aim for at least 2 liters a day of that stuff. There's a recipe right here. It doesn't taste the greatest. I have read that it's probably just as effective to just drink a lot of purified water and eat some crackers or pretzels, which is a little more palatable than this formula. However, in emergencies, this formula can save people's lives for really, really bad diarrhea. So it is used around the world.